Hi, I'm Dr. Cynthia Browne. I'm a radiation oncologist here at the Van Alslander Cancer Center, and I specialize in breast cancer, but I'm going to talk to you about vitamin D, which is my favorite hormone. That's right, it is a hormone. We make it from the sun in our skin, and in southeastern Michigan, we make it from late April until about Labor Day, so we're done making it now for the rest of the year. You have to have skin exposed in order to make vitamin D. So although you can sometimes get a sunburn through some clothing, you do not make any vitamin D through clothing. You have to be out during the central part of the day, because if the rays are coming in at too much of an angle, the ones that make vitamin D, then those are absorbed by the atmosphere. And so if you only go out in the evening after work, you're not making much vitamin D. Other reasons you don't make vitamin D is if you wear sunscreen, and that's going to block almost all vitamin D production. If you have really dark skin, you don't make vitamin D very well either, at least not in Michigan, where we only have a limited amount of time to make it. And so why is that a problem? Well, because it is a hormone, it helps run all the systems of your body. And if you are low, which most of us in Michigan are if we don't take extra supplements, you have more cancers. You don't do as well with your cancer. You have more autoimmune disorders like psoriasis, lupus, multiple sclerosis, rheumatoid arthritis, because it is a major regulator of the immune system. It also regulates the cardiovascular system, so you have more heart disease. If you are low, especially more high blood pressure. You have more diabetes, both adult onset and juvenile diabetes, because juvenile diabetes is actually an autoimmune disorder. You have more osteoporosis, where your bones get thin. You have more aches and pains. In fact, there are estimates that about 2/3 of the people who are diagnosed with fibromyalgia actually have low vitamin D. You have more muscle weakness. You have more babies with autism and schizophrenia if you are really low and you are pregnant. And you have more cognitive decline as you get older, so the brain doesn't work as well. So it's a big problem when it's low, and this didn't used to be recognized. This data on vitamin D has just been pouring out over the last 15 years. And so I try to get patients to a blood level of about 65. I say aim for retirement age for your blood test for vitamin D. It's a simple blood test, but it is not part of any standard panel for blood testing. So if you ask your doctor for it, it has to be ordered separately. And I'm perfectly happy with sort of 55 to 75. And it usually takes for most people about 5,000 units. It doesn't come in milligrams generally, it comes in international units, 5,000 units per day to get that level. And if you're really low, you start taking it, it takes about 6 months to normalize your blood levels. And for every 1,000 units you take, you raise it roughly 10 points. That's kind of a rough estimate. And so if you're at 30, we'd like you sort of around 60, you could take 3,000, 4,000. It comes in 400 units, 1,000 units, 5,000, 10,000, and 2,000. 10,000 is hard to find, although we do carry it here at the Healing Arts Center in the Van Alslander Cancer Center. There is a prescription one that is given usually once a week. And that's usually 50,000 units once a week. I don't prescribe that very often. I only prescribe it for patients who get their prescriptions free and can't afford $3 or $4 a month. And in fact, I just yesterday at Sam's Club bought a bottle of 400 pills of 5,000 units for $7. So that's less than 2 cents a pill. So it is really inexpensive, and it does a lot. The over-the-counter one is 9 times more potent than the prescription one, and it lasts in the body much longer. The half-life of the prescription one is 2 weeks, meaning in 2 weeks, half of the vitamin D in your body is going to be gone. The over-the-counter one, the half-life is 90 days. So it's much more effective. And there are some people, I cannot get their vitamin D levels up very well with a synthetic when I can do it with the vitamin D that's over the counter. And some people have trouble getting their vitamin D level up because they have abnormal receptors. Hormones have to go into a receptor and be translated, so sort of like a TV satellite dish catches a signal and then it's translated into something we can see on our TV. The hormone has to come into this receptor and then be translated to tell the cell what to do. And some people, if you have a receptor that's a little bit misshapen or something a little bit abnormal with it, then we sometimes have trouble getting vitamin D levels up, and I have to flood people with very high amounts of vitamin D. Now, people ask me all the time, can you take too much? Well, you can. I've never seen it. I struggle to get people to 65. We consider here at St. John's a normal level between 31 and 120. And it's really hard to get that high. If I were 20 years old working as a lifeguard all summer long in a bathing suit with no sunscreen, I don't like sunscreen. I think it's bad chemicals and blocks you from making vitamin D. But my level at September would probably be about 100. We're much better at making it when we are young. In fact, if you take a 6-year-old in a bathing suit at high noon in July, they will raise their blood level of vitamin D the equivalent of taking 20,000 units per hour because it's needed to run the body. You can actually tell the difference in a fetal skeleton by 19 weeks if the mother has high enough vitamin D. And one thing that I find it, really a travesty is that prenatal vitamins have very, very little vitamin D in it. And of course, there's no vitamin D in mother's milk if the mother doesn't have it. So typically, breastfed babies are given vitamin D drops. Much simpler to actually give it to the mother, usually needing between 4,000 and 6,000 units per day. It will help her health, it will help the baby develop better, it will give better brain function, and then the breast milk will have adequate vitamin D in it as well. So the only times we really see serious consequences, and you can die from too much vitamin D, is if people are taking astronomical amounts, like the 50,000 units over the counter, that's over the counter. I've heard you can buy it on the internet over the counter, and people take it every day for several years, and then their levels are 700, and they can die from that. Or very young children who are given drops of vitamin D, and the parent gives them an entire dropper full instead of one drop. And so there have been some cases where the babies had vitamin D levels of 400, 600, and they died. But in normal kind of taking it, it is very, very difficult to run into any kind of problems. The main problem is that the calcium can get too high. And so anytime you're checking vitamin D, usually we check calcium, but I've actually never seen that as an issue either. So vitamin D, which is incredibly inexpensive, can do more for your health than so many other things. And so please check with your doctor, have your vitamin D level checked, and see how low it is, and start taking vitamin D. There's an occasional small woman who can get good levels with 2,000 units, but most of us need 4,000 or 5,000 units a day. You can start giving vitamin D drops to a child of 1. And because kids are not outside anymore, and they're inside on their computers playing video games, I can't get my teenagers to go outside. They say there's nothing to do outside. And so our children are having a big problem with that, and you have far more depression if vitamin D is low, and that is now an epidemic with our children and adolescents. So I encourage you, start on vitamin D. You will feel better, you'll have more energy, your aches and pains will start improving, and all of your health problems will slow down.